Hello everyone, this is Stephanie Lee, your student nurse, and for today's video, I will be showing you how to do the bag technique properly. So what is a bag technique? It is a tool by which the nurse, during her home visit, will enable her or him to perform a nursing procedure with ease and deftness. It is also essential and indispensable equipment of a public health nurse, which she has to carry during her home visit. This is also to save time and effort in rendering effective nursing care to the clients. Let's move on to the common materials that you should put inside the bag. Upon arriving in the client's home, make sure to greet and introduce yourself to the family. Assess the client's need. Establish rapport with the family members to promote cooperation. Identify the client and explain the procedure that needs to be done. After that, take the client's history and ask them if they have any flat surface like tables. Magandang araw po ma'am. Ako po si Stephanie Lee, ang inyo pong student nurse galing sa J.H. Syria State College, Pagadian. Ngayon po ma'am, magkakandak po ako ng home visit tsaka po ng bag technique. Mamaya po ay papaliwanag ko kung ano ang proseso ng gagawin ko sa inyo. Pero bago po yon, titingnan ko po muna kayo at kukunin ko rin po ang health history nyo. Sumasang-ayon po ba kayo ma'am? Okay po, maraming salamat ma'am. Matanong ko lang po kung meron po ba kayong lamesa na pwede ko pong gamitin para paglagyan ng aking mga gamit para po makapagsimula na tayo. Okay po ma'am. Before putting the bag on the table, make sure to spread or put a paper lining clean side out. Meaning to say that the clean part should be on top and the outer folded part should be touching the table, then next to the plastic lining. So the rationale for this is to prevent the bag from getting contaminated. After putting the plastic and the paper lining, put on the bag on the left side. Make sure to put the straps underneath to prevent contamination. Open the bag and take out the hand towel, the soap dish, and the soap inside. Close the bag to avoid any contamination, then do the hand washing. You can ask your client if they have a basin and a glass of water, or much better, a running water available, so you can use this for you to perform hand washing. So hand washing is essential before doing the procedure for you to not spread any infection or prevent the spread of microorganisms from the health worker to their clients. I am done washing my hands and I will be putting this one on the right side. After that, I will open my bag and take out my apron and keep it closed. Observe the proper technique. So the apron is necessary because it will protect the nurse's uniform. After I put on my apron, I will be taking out or putting out all the necessary materials that I will need for this procedure. And I will be doing the thermometer technique. Now this is my paper receptacle and I will put this on this part and start with my procedure. This is the cotton balls moist with soap. And this is the cotton balls moist with water. After the care is given and health teaching is over, remove the cotton ball, wrap around the thermometer. Wipe with a dry cotton ball and return to the case. After doing all the necessary care, make sure to clean the materials before putting them inside the bag. So this time, I will be using the cotton balls with the 70 solutions of alcohol. I'm just going to clean all the materials that I used and put them inside the bag. The rationale for this is to prevent the spread of infection and protect the health worker. cleaning all the materials, you can now proceed with doing your hand washing. After hand washing, I will also spray alcohol before putting all the materials inside the bag. I will now be removing my apron by observing the proper technique, but don't let your hand touch the outside of the apron.
Remove your apron by folding it away from you. Remember, the clean side must be out and the soiled side must be in. After that, put it inside your bag, close your bag, and then get the plastic and the paper lining, put it inside the paper bag, and then throw it away.
Record the visit accurately. Write down all the necessary things to know in the assessment and observation and the nursing care and treatment done. For the last one, make an appointment for the next visit by writing the date and time. For the evaluation and documentation, record all relevant findings of the client and members of the family. Take note of environmental factors which affect the client's family's health. Include the quality of the nurse-patient relationship. And lastly, assess the effectiveness of nursing care provided. That would be all for this procedure. Thank you so much for watching.